Hi, I'm Nikhil Kurele, co-founder and CEO of Noccarc. We at Noccarc are making healthcare smarter and technologically advanced with our smart medical devices. Today I'm here to give you a complete overview of the most innovative and functional smart ICU ventilator Noccarc V730i. Adding Noccarc V730i ventilator to your ICU will add immense value as Noccarc V730i solves for all the key requirements of users and the hospitals. It allows you to treat all wide category and types of different patients with just one device. It has extremely user-friendly interface and easy operating protocols. It has lowest operating and maintenance cost in the segment, and it comes with inbuilt digital capabilities like remote monitoring and remote diagnostic. The beauty of Noccarc 730i is that both hardware and software capabilities can evolve over the period of 7 to 10 years of usage with the features like expansion modules and OTA updates. Now let us have a look at the device. So Noccarc V730i is a compressor-based ventilator which is compatible with both central medical air supply line or a standalone compressor which can be part of the ventilator unit itself. For oxygen, we have both options of central oxygen supply line or a regular oxygen cylinder which is available in the hospitals. The screen comes as a standard with a 15-inch option, and it allows you better visibility and easy control of all the parameters. The screen can be tilted and swiveled for better viewing angles. The 360-degree lamp with an audio alarm ensures that none of the alarm goes unnoticed. The standard trolley has mounts for both humidifier and bubble CPAP. It also has a space to mount an oxygen cylinder for easy intra-hospital movement. Also, at the same time, the guardrails, which actually in this case also becomes the handle, ensures that your machine is safe even in the movement in the tight spaces.
So now let us have a look at V730i in detail. Currently, we have both adult and pediatric option available in the ventilator. In future, neonatal mode will also be given as a software update. And the unique part is to just get a neonatal mode, you have to get a software update only. There's no hardware which is required to be changed in the ventilator. Talking about the pediatric mode, the minimum tidal volume you have in the pediatric mode is 15 ml. As we can see here, the 15 ml. And the unique part about our pediatric delivery up to 15 ml is you do not require any proximal flow sensor. That saves on the consumable cost as well as unavailability of the special consumables, which actually saves you time and also offers you higher uptime. Talking about the patient running the ventilation, you need to select the patient category. For example, let's select the adult patient here. You actually put the patient details and then save the details or skip it. Then you come to the main menu where all the modes are available. Starting from the non-invasive, you have the basic mode, which is high flow oxygen therapy. Usually it comes as a separate machine. We have inbuilt the HFNC mode directly in the machine, which allows you to save on the investment. And for HFNC mode, you have both FiO2 and the flow rate up to 100 LPM electronically controlled. The only thing which you have to do is attach a HFNC attachment directly to the ventilator. In case you require the non-invasive modes, you have the options of an IV pressure support, which is a CPAP mode, and also you have a dual PAP mode, which is a BiPAP mode available in the machine. An IV pressure support mode also comes with an apnea backup, and in case now you require an invasive mode, the only thing which you have to do is select the invasive modes. You have all the modes available right here in the screen, where you have assist control modes like pressure control, volume control, PRVC, then advanced modes like SIMV pressure control, pressure support, SIMV volume control, pressure support, SIMV PRVC pressure support, APRV, and then you also have additional high-end modes like support modes, pressure support CPAP, volume support volume control, volume support PRVC mode. For example, if we select any of the modes here, you go to the settings menu and it is extremely user-friendly to operate this particular machine, and only thing which you have to do is change the settings. Once you click any of the values, you get to this particular pop-up window where you can slide the bar to adjust the settings, and also you can use the plus and minus to accurately set the particular setting. Once you save the setting, you go to the alarm menu so that we ensure that none of the alarms can get skipped. Once, for example, if you are in hurry where you actually want to ensure that the ventilation is done at the faster speed, you also have an option of auto set where you press the auto set button and all the alarm values are adjusted according to the setting which you have made in the particular mode. Once you save it, you go to the main screen where you start the ventilation, and once you start the ventilation, you come to the main ventilation screen where you see each and everything which is required to be monitored in a ventilator. Talking about the uniqueness, the graphs are auto-scaled. So from the next breath, graphs have already auto-scaled so that you do not have to engage with the machine to give you a better insight. In the screen, if we see, The screen has been divided in 5 main key parts. The top bar is dedicated for the notification for all the alarms and all the settings, which actually will be visible no matter where you are in the ventilation screen. The left bar actually has all the main key settings parameters, where you have the modes, alarm profile, events, and everything which actually is required during the ventilation or even during the ventilator settings. The bottom bar ribbon has been dedicated for the ventilator settings, where you actually can select any parameters and change the value while the ventilator is running, and you do not have to go back to the main screen and to the modes page to do these setting changes. This allows you better control and observation of what actually is happening to the patient when you change the particular setting. For additional settings, you can you can press this button and see the different settings which are also available in this particular mode. And then we have a dedicated window which also allows you to monitor the parameters which are being delivered to the patient. And the beauty of this particular bar is you also have the lower and the upper limits of alarm, so that it can easily guide you what exactly is the reason causing the alarm which actually is coming, because alarm management is actually one of the key things which is required inside an ICU. For additional settings which are not visible here, you can press the ribbon and you can see the remaining settings, the parameters which are being delivered to the patient, also available in the screen. Talking about the switchover of the modes, for example, you are running a machine on an invasive mode, but you want to now switch the patient to a non-invasive mode. The beauty of Noccarc V730i, you do not have to go on the standby. You directly can go to the non-invasive mode, select these settings, and as you can see, all the key settings have already been fetched from the previous mode, so that you have a clear clarity what actually was the set parameters. And once you do the save and auto set, you go to the mode directly. You do not have to switch between the mode and you do not have to stand by the machine. Now coming to the modes part, you still have the access to all the modes. You go to the modes and you can change it from any mode to any mode, and you will be able to see the switchover is very smooth and does not require you to basically change the settings again. Now coming to the alarm profile, for example, if you have changed the ventilator setting right from the bottom bar and you now want to ventilate a patient in a different setting. So right now we are running the machine in SIMV mode. For example, if I change it to the volume control mode, you actually have an option directly coming to this particular window, and then alarm profiles for this particular setting and this particular mode can be changed right from the alarm profile window without even stopping the ventilator. An auto set option also works at this particular window. Now, one of the unique things which we have in all the volume control modes of V730i is the feature called flow slope. For example, if you have a patient who is sedated and your set tidal volume requirement is somewhere around 400 ml, but the patient is now coming out of sedation and the volume requirement has increased, to prevent desaturation, you have a feature called flow slope, where when you make the flow slope as 0, the machine starts to sense what is the actual requirement of the patient and ensure that the patient requirement is sufficiently catered. At the same time, the machine also ensures that the set minimum minute volume is guaranteed to the patient, so that even if the person again goes back to the sedation stage, the patient actually is getting the right tidal volume. Now, one of the important aspects of a ventilator is how the ventilator is communicating you about the patient, and that is where one uniquely designed event log system, where you have all the filters available. For example, you are in front of the machine and you want to monitor just the active alarms, you have the filter of active alarms. For example, if you are a doctor and you are visiting the ICU after 12 hours of window, you actually can go to just the physiological alarms and can actually see what kind of alarms which are related to your observation has come in the machine. For a biomedical engineer or a staff which actually is managing the machine, they can also select technical alarms and they can resolve these alarms whenever it comes. At the same time, you also have the operational logs. For example, if there's a consultant doctor who is visiting this particular hospital, they can actually monitor how the ventilation for a patient has evolved or has changed in the last 24 or 48 hours window right here, along with the time. Now talking about the views options, you have multiple views options for better understanding of what a ventilation is actually happening to the patient. The basic option is where you actually have all the 3 graphs, scalars, and then you also have an option of loops, where the loop window also is auto scale. So once you see the loops are formed, one very important aspect of loop is when we actually treat particular patient and want to see how the lungs are changing, and that is where you come to a feature called reference loop, and by just changing the different settings of the ventilation or the lung, you can actually see how the loop is actually changing. And also with a feature called freeze loops, you can actually assess the lower inflection points and the upper inflection points of the ventilation. In case you decide to also monitor two scalars and loops at the same time, the Ventilator V730i has that feature, and you can monitor both pressure flow loops and volume pressure loop and flow volume loop. That is available right at one screen. Now going back to the main scaler, talking about the maneuvers, which actually is the very essential aspect of a ventilator, the two static assessment options which we have given in the machine are the inspiratory hold feature and the expiratory hold feature. And the beauty of our design is that all the values which are required while performing this particular assessment is available right here at the screen. For example, the plateau pressure, auto peep, static compliance, elastance, and even you have the dynamic compliance available at the monitoring parameter. Now going back, similarly you can also perform the expiratory hold, and all the parameters will be available right here. Going back to the O2 boost option, in case you want to basically give a O2 boost, but you do not want to give 100% oxygen, you also have an option of adjusting the O2 boost percentage of FiO2. At the same time, to prevent over oxygenation, we have given a timer of 2 minutes. So every time you actually oxygenate a patient with using O2 boost, the maximum time the machine will supply O2 boost is 2 minutes, and automatically it will stop. Now coming to the suction support, which is one of the unique part of our ventilator. So what happens using suction is you pre-oxygenate the patient and you clean the suction, you clean the secretions, and you then connect the patient circuit. And these particular window, what actually happens is a lot of times the ventilator starts giving alarm. We have made this a smart feature where you start the suction support, and once you disconnect the patient, the machine automatically senses that the patient disconnection has happened. And to prevent the post-oxygenation miss out, what we have given is the machine automatically senses the connection of the patient, and the post-oxygenation is automatically started. Once you click the finish, that is where you actually have the suction completed as a feature. So for example, if you have asked your nursing staff who is in front of the ICU bed can actually to perform the suction, you can actually see whether suction has been completed, where the post-oxygenation and pre-oxygenation have been performed right here at the event slot. So that basically ensures that the patient safety is maintained. Talking about other features, so weaning becomes a very essential part of a ventilator, and that is where, so instead of performing multiple settings and ensuring that what is the kind of pressure which the patient lung is able to apply, you have a feature called negative inspiratory force. When the patient applies a suction, basically creates a negative pressure to breathe in, you automatically get the value of the force which the patient is trying to apply. And that gives you a clarity whether the patient is supposed to be weaned or not. Similarly, you have the occlusion pressure measurement option as well. Once you start that, the values get recorded, and once you actually stop this, you have the trail of all the values which have changed over the period of time right here at the window. Manual breath is one of the essential things where actually the problem happens, where when you disconnect the patient from the ventilator and use ambu bag to give manual breath, a lot of times the change in the distance of the ET tube, a lot of times you do not have the control on the volume and the pressure which is being given by the manual breath. The beauty of this machine is you actually can press this manual breath button and you can give the manual breath, which actually has the controlled parameters which can actually also be changed during the ventilation. So to give a manual breath, you do not require to disconnect the ventilator and use the ambu bag. The Ventilator V730i solves that particular problem.
So talking about the additional features here, these are very uniquely designed to meet the requirements of the Indian conditions, where a particular hospital can actually see a patient who is ready to pay anything which is required for the good quality treatment, but then we also have patients where the treatment cost is limited by the economical background or also from the insurances. What we have here is both pneumatic nebulizer and ultrasonic nebulizer option, whereas the ultrasonic nebulizer can be connected through these expansion ports. And the beauty of our ultrasonic and pneumatic nebulizer here is that it actually works at the time when the patient is breathing inside. For example, if our I by E is set as 1:2, in that particular situation with a conventional nebulizer, 66% of the drug get wasted, which here in Noccarc, as you can see, it only provides drug when the patient is breathing in. That actually saves on the cost and also at the same time increases the profitability or actually decreases the treatment cost. In case if it is required, the ventilator also provides an option of pneumatic nebulizer. In pneumatic nebulizer, you can just connect the cost-effective consumable of pneumatic nebulizer and can run the machine And the beauty of our pneumatic nebulizer is that in the volume control modes, where the additional volume which is being added by the pneumatic nebulizer is already compensated by the machine, so that the tidal volume which is actually set by the doctor or a clinician is actually delivered to the similar range, including the volume which is added by the pneumatic nebulizer. As you can see, there are multiple other expansion ports. So what we have actually here is these expansion ports can be used to actually connect the capnography module, and the unique part about our capnography module, it is mainstream volumetric capnography measurement technology, which also allows you to calculate certain parameters like dead space, which becomes very essential when using the capnography with the ventilator setup. The same thing is not possible with the monitor, so that is where this capnography along with Noccarc 730i yields better clinical outcomes. Some other expansion of modules which are available in this ventilator are SpO2 module. Then in future, for example, if there is any other module which actually comes to the market by Noccarc or by any other company, can also be connected with this ventilator with the expansion ports available on the back side of the ventilator. Another unique problem which Indian ICUs face is around the space of the ICUs, and that is where what we actually have is the smart humidifier options. What we have here is the humidifier which usually is available lower to the bedside, and that is the reason why alarms of the humidifier gets missed out. This particular problem has already been addressed in Noccarc 730i. What options do you have here is you can actually monitor and control the humidifier directly from the ventilator screen, so that you do not have to jump between multiple screens to operate the humidifier, and all the alarms of the humidifier and the heating levels can actually be set directly from the humidifier, directly from the ventilator. Then we come to the patient history module, which allows you to monitor the history of last 10 days, and in some case even extends to beyond. And what actually we have here is, for example, if you click to particular ventilation setting, patient history, unique part about our patient history is that you do not only monitor what actually was being delivered to the patient, at the same time you also monitor what was the set controlled parameters, at the same time you also monitor the alarm profile, so you have a better picture and a better clarity on what was actually happening to the ventilator when actually the ventilator was running even up to 10 days ago. So now talking about some of the key safety features of the machine. This particular machine, as it runs on both compressed air and compressed oxygen, in cases of any particular gas failure, the machine switches over to the other gas which is available. For example, in case your central supply line goes bad for any of the reasons, the machine automatically switches to the oxygen and start giving you the alarm, so that you are also aware what actually has happened wrong in the particular system and a setup. But at the same time, the accurate volume is still delivered to the patient, and the patient safety is not getting compromised. In the similar manner, we also have sensors inside the machine which controls the FiO2. So even if the oxygen sensor goes bad, the FiO2 delivery does not get compromised. And even when you are required to change the oxygen sensor in a period of 12 to 14 months, changing an oxygen sensor is just like changing a remote cell by just opening this flap which is available. At the same time, we have also incorporated some backup sensors in the machine, which ensures that the redundancy is available even in case a particular sensor fails. So for example, if the expiratory sensor fails, the inspiratory sensor ensures that the tidal volume accuracy is still there. Similarly, two pressure sensors are used, so that in case of one pressure sensor, the other pressure sensor ensures that the right pressure sensor values are being delivered to the machine. Now coming about one essential part, which is the running cost of the machine, and four key components which play a very important role in during the lifetime of the machine is the expiratory cassette, the battery, the flow sensor, and the oxygen sensor. Let me talk about some of the unique and patent innovations which Noccarc has done. The first one is around the expiratory cassette. The quality of the expiratory cassette actually determines when actually you are measuring the pressure and the flow values. The unique part about our expiratory cassette is, first thing, we have moved all the electronics inside the machine, so that automatically this expiratory cassette becomes very affordable, and in cases of positive patients, you actually can dispose of this particular expiratory cassette, and the cost of disposing it is actually very minimal. And also, this does not have any moving part inside it, which ensures that the accuracy at day 0 and day 700 remains the same, and this can be autoclave as well as ETO options are available. Now talking about the oxygen sensor, as I have already briefed you, changing an oxygen sensor is just like changing a remote cell. And the second component which actually is very important is the battery. The cost of the Noccarc battery, which is right now allows you to run this ventilator up to 4 to 5 hours, even after 3 years 2 to 3 hours window is guaranteed in this particular ventilator, and changing the battery whenever you require that particular change is just the cost of changing a battery is 1/3 of the usual batteries available for a similar kind of products available in the market. And the unique design is there is no flow sensor which is required to be changed in the machine for the lifetime. All the sensors which are there apart from the oxygen sensor are also covered in the warranty. Talking about some of the unique features which is only available with Noccarc is the digital capability. By connecting the ventilator with a Wi-Fi, you not just are able to monitor the health of this particular machine remotely. So for example, if something goes bad with your particular machine and you require a service support, the only thing which you have to do here is just connect the machine with any of the Wi-Fi's available in your particular hospital, and we at Noccarc head office will be able to monitor and diagnose, and to some extent will also be able to repair the machine and actually address the uptime guarantee for you. Now, one of the unique things is available in Noccarc is the OTA feature, which is only available in the ventilators globally in Noccarc 730i, is the OTA feature, which is similar to what you have in your mobile phones and laptops. For example, if you are using your mobile phone or a laptop for 4 years to 5 years, you use it because they get continuous software updates which makes it relevant to the current requirement. Similarly, when you are using the ventilator for 7 to 10 years of usage, along with these expansion ports, we also have a OTA feature which allows you to upgrade the machine for next 7 to 10 years of usage by just connecting it to a Wi-Fi. You do not even require a Noccarc representative to be present in the hospital to upgrade the machine to a newer feature. And the most unique aspect, solving one of the major challenges, unavailability of doctors in front of the ICU bed, is the feature called Horizon View. And you can activate the Horizon View feature right from here. And when you start the ventilation, for example, these are the parameters which actually are being delivered in the machine. And when you actually want to monitor these parameters, you right now have to depend on the nursing staff or the clinician staff to share this data. What uniquely we offer here is that all this data can be remotely monitored right at your laptop, or if required, also at your mobile phone. And with this, you are not dependent on any of the nursing staff or the clinician staff for this particular value. This allows you a better control and overview of what actually is happening to your particular patient.